We begin today with the uptick in U.S. COVID-19 cases. 9 states are now reporting record hospitalizations, across the country. Across the country, we near 3 million confirmed infections. But scenes from over the weekend show many are not heeding warnings to social distance. These are partiers at Diamond Lake in Michigan, packed together. And a similar scene at a pool party in Missouri, the establishment just next to where there had been an outbreak weeks ago. It comes as Dr. Anthony Fauci issues a concerning new assessment. Our Matt Gutman leads us off.
Tonight, those throngs slammed together in 4th of July parties across the country, cementing concern basic messaging like social distancing is not being followed. At this lake in Michigan, hundreds partying shoulder to shoulder and few masks in sight. And this packed concert inside an Atlanta nightclub. And to Nashville and Oakland, those crowds igniting fears the coronavirus is spreading faster and deeper into the country. In just the first 6 days of July, 250,000 new infections nationwide. Dr. Anthony Fauci today not mincing words.
The current state is really not good. It's a serious situation that we have to address immediately.
In Florida, new cases doubling over the past 2 weeks. Miami-Dade's mayor reversing course, closing restaurants and gyms. Stephen Cooper, seen here on the far left of this iconic photo, sprinting from the falling Twin Towers, surviving 9/11, only to die from COVID-19 in Florida. Dr. Nema Kabir is only in the 2nd year of his residency, forced to the front lines in a Miami hospital.
We had colleagues who were testing positive and had to be quarantined, and so, the rest of us have to pick up the slack.
President Trump coming under fire for once again downplaying the virus, incorrectly attributing the surge in cases to increased testing.
Now we have tested almost 40 million people. By so doing, we show cases, 99% of which are totally harmless.
New York Governor Andrew Cuomo today saying the president is enabling the pandemic.
What he's really saying is, if we didn't test, we wouldn't find the cases. So on that theory, let's do no more cancer tests, and that'll solve the problem with cancer. Mr. President, don't be a co-conspirator of COVID.
And presumptive Democratic presidential nominee Joe Biden's campaign saying in a statement the president is outright lying to the nation about the extreme threat of COVID-19. Tonight, the White House defending the president's comments.
The president was noting the fact that the vast majority of Americans who contract coronavirus will come out on the other side of this.
9 states hitting new records for hospitalizations this weekend, including Texas. A record number of people hospitalized in Arizona, now one of 8 states with more than 100,000 cases.
We see young people coming into the hospitals and saying nobody told them that they would get sick. Young people do get sick. We've seen young people get sick, and we've seen young people even die.
In California, the governor shutting down indoor dining and bars in San Diego and 5 other counties and stepping up enforcement on businesses. One doctor warning tonight.
And if we all don't get our acts together, then there's really no place in the country that's going to be spared.
And Matt Gutman joins us now from California. Matt, there are some new numbers out tonight showing how the virus is affecting Americans disproportionately along racial lines. What do we know?
We have had anecdotal evidence that African Americans and Latinos have been disproportionately affected, right? The numbers are higher, but there wasn't a tremendous amount of hard data. The New York Times sued the federal government to obtain data that has been gleaned by the CDC. And this is what we now know, that African Americans are 3 to 4 times more likely to contract the virus than their white neighbors, and that Latinos and African Americans are much more likely to die from the virus than their white neighbors. We don't know why that is exactly. It could be because they are more essential workers. That part of the survey is not yet known, but what is clear is that what has been anecdotally presenting itself over the past several months is now backed up by hard data. Diane.
Yeah, sad truth. Matt Gutman for us from California. Thanks, Matt. Now let's go over to epidemiologist Dr. Feigl-Ding for more on the growing number of COVID-19 cases and hospitalizations. Doctor, thanks for joining us.
Thank you. Happy to be here.
So public health officials are warning now that young people without underlying conditions are not immune to this virus. And we were all sadly reminded of that yesterday when 41-year-old Broadway star Nick Cordero passed away after a roughly 3-month battle. Are these so-called long-haul cases where people struggle against this virus for a long time becoming increasingly concerning?
Yeah, the illness is not as mild as people think it is. It is definitely not 99% harmless, as the president or his chief of staff have said today. It's really has long-term impacts on your metabolic health as well as actually your brain health as well. So I think the fact that so many young people are being affected just balloons the total number of cases that will ultimately harm Americans. And this is why we have to be vigilant, even if you're young.
I just want to expand on that a little bit, because it seems like when we talk about this virus, it's often in the camp of either you're going to die or you're going to be fine. But what seems like what we don't often hear about is concerns about long-term effects for survivors.
Yeah, indeed. There is a lot of evidence that people have long chronic fatigue illnesses. There is some brain and dementia issues among some patients who survived the ICU. And of course, there's blood clots. And there's some evidence that actually might cause diabetes. So altogether, there are so many reasons to avoid this. And just because we have hospital beds free is not a reason to keep going out and living a dangerous life.
Now, we just learned that Atlanta Mayor Keisha Lance Bottoms tested positive but was asymptomatic. So given how we know about asymptomatic testing, should we be pushing for everyone in the country to get tested?
I think we should we're still behind in capacity. We're still not testing enough people, and we're actually falling behind because our caseload has been rising so fast. So we're not at that point where we should test everyone yet or at all. I think we should still go with targeted early testing, because once you test, you want to isolate them, you want to contact trace them, and then quarantine their contacts. That is the main formula for fighting epidemics, because most epidemics in the past have been fought off and won without a vaccine with this classic strategy. But we're neither doing that, nor are we doing, again, testing enough for the people with symptoms. And asymptomatic is this one problem. It's such a pernicious virus that it will keep popping up and up until we ultimately have masks for all or a vaccine.
On that note, 239 scientists penned a letter to the World Health Organization outlining evidence that small virus droplets can remain in the air and infect people. But the WHO says there's not enough evidence to prove the virus is airborne. So where do you fall on this? How do you explain this to the public? And if it does spread through the air, do we need to change our approach?
Yeah, absolutely. And 239 pretty well-regarded scientists, I would like to say. And this WHO always errs a little bit too on the cautious side. They said there was once no human-to-human transmission. There was we don't know about masks. But just because we don't know about something for certain does not mean we should ignore it. And right now, these aerosol scientists who study airborne particles for a living show that these microdroplets can stay in the air for 20 minutes or longer. And this is why it's so important to focus on mask wearing and improving ventilation and avoiding congregated places where people are just spraying their saliva indoors, such as in bars and nightclubs.
All right, good advice. Dr. Feigl-Ding, we appreciate your time as always. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.